When I was diagnosed with cancer 7 years ago with bladder cancer, the treatment, I was allergic to it, and it caused during treatment and afterwards for me to really be in pain 24/7. There was never a time I was not in pain, whether I was sleeping, waking up at nighttime, or during the day, at work, with my kids. I mean, no matter what it was, I was always in pain. And so that was really difficult to try to live this life and be in pain 24/7, but I felt like I had to push through and do it. I couldn't let the pain stop me from living. Dr. Sharpe was really the one who, when I told him, I don't want to just have my bladder out, I believe there's another solution, and I believe I'm supposed to have a bladder inside and not a bag on the outside. And he was the one that really listened to me, and he really thought it through. And he thought of Dr. Carney, who is this specialist who does this particular surgery, which is very rare. It's not a surgery that's done all the time. And it's mostly done on children because they recover quickly. And so he thought of Dr. Carney, and then the next step was, would Dr. Carney do it? And then the next step was, would the hospital allow it? Because Dr. Carney comes from Emory. And so it really took a lot of collaboration. It took really trying to seek out how this was going to work. And once Dr. Carney and Dr. Sharpe put their mind to it, to do the surgery and approach the hospital and got permission, then it was a go 100%. And so May 31st, I had that surgery. And so I'm about 7 or 8 weeks out now. I still have recovery to go, but my life is 100% better than it was before this surgery. The quality of life that I have now, I am in a little bit of pain just in recovering because it was a very big surgery, but really the truth is that it's not even comparable. I mean, I would wake up in pain. Now I wake up and I have a smile on my face, and I'm ready to go. It's just incredible. So I'm ever so thankful that everybody worked together and enabled me to have this surgery. Georgia Urology was a complete change for me. I was used to going in and getting my treatment and leaving. And this was completely different. Dr. Sharpe, our first visit, spent about 45 minutes with me, talking to me, just asking me questions, wanting to understand what happened, why it happened, and then what did I want? What was my desire? And all the way back then, I was like, well, I want a new bladder. That's what I want. He kept saying to me, I can introduce you to people that, have had this surgery, meaning the surgery with the bag on the outside, and they have a full life, and they're able to do all the things that you want to do. And I was pretty determined that that wasn't what I wanted. And instead of him just pushing me away and saying, well, it's either this or nothing, he said, we'll keep looking. Meanwhile, he took care of me. Meanwhile, I had to have my bladder looked at, and I had to have, biopsies done and all of that. And so he was my doctor. And I mean, I could call that office and have any question, and either his nurse, his surgery nurse, or he would call me back. I mean, I felt like I meant something at that office. And, that's sadly, it's almost a rare occasion these days, but I was just really thankful for that and felt like I could trust him, that he really was going to look, he was really going to see if there was something that really could be done for me. And of course, we know he did. He came up with the solution. Yeah, I would say the very first thing is you have to know what you want. That's the first thing. I mean, you listen to your doctor. You listen. I mean, I went and got second and third opinions. I mean, you listen to your doctor, and I agreed with everything that he said except for not getting a bladder underneath. And he knew that. He knew that that's what I wanted. That was what I was ready to go up to Minnesota for. And I think once he saw that determination, it just came to him. It just clicked that, wait a minute, I do know somebody who can do this. And he told me, I'm going to reach out to him, and he'll probably call me back tonight. And that's exactly what happened. And so, Dr. Sharpe called me. I think it was either that night or the next day. And then Dr. Carney called me on the phone, and I talked to him for 45 minutes. I mean, it was extraordinary. The whole stepping through the process was extraordinary, because I really felt like these guys cared about me and my quality of life. And I wasn't just a patient. I wasn't just a number, that they cared. And that made a huge difference. I think the major part for me was that Dr. Sharpe is a very humble man. And he immediately said, look, I'm not the expert with this surgery. It is Dr. Carney. And he's the one that does these. I am going to assist him, and I will be with you every step along the way. He said, but Dr. Carney is the expert. He's going to do the surgery. I'm going to assist him. And I was like, great, thank you for telling me. It would have been so easy for him to just keep that to himself, but he felt like it was important that I know that, and I appreciated that. And then in speaking, with the both of them and understanding the complexity of the surgery, that it isn't just making a new bladder and putting it in, it is my colon being cut and formed into a new bladder. It is disconnecting my kidney, the uterus, from my bladder, and then reconnecting them to a new one. And with me, I had tumors that went up almost into my kidney. It stopped just short of my kidney. And so I was worried that he wouldn't have enough to connect. That was the only thing I was concerned about. But he was like, no, we got it. It's fine. We did it. But they, both really explained the surgery and the complexity of it, and really wanted me to understand that the hardest part of it would be recovery, and it's a very long recovery. And, to me, that was not insurmountable. To me, that was like, okay, well, that's part of it. The very first thing I remember Dr. Sharpe saying to me is, the surgery was picture perfect. And I was just elated. I was, of course, still really drugged, but I remember that. I remember him being so pleased. I could see on his face that it had gone extremely well. And I just relaxed. I just had complete peace about it, And then Dr. Carney, when he came in, it was the same thing, that he was like, it couldn't have gone any better. It was picture perfect. And I was like, oh, thank you, Lord. Just what an incredible blessing that this very complex surgery, and it couldn't have gone any better.